Hello, everyone. My name is Hsien-Yi Yang. I'm a second-year medical student at Midwestern University, Glendale. Today, I'm going to present a topic of type 2 diabetic crisis in the United States from a behavioral approach. Introduction. The US is one of the largest diabetic populations in the world. Medications and nutritional supports are important. The prevalence of type 2 diabetes is projected to increase within the next decade. Here we are developing some intervention strategies from the behavioral approaches and on a community level. So obviously, our public health issues selected is the type 2 diabetic care and management. Our target population includes patients with type 2 diabetes with the focus on minority groups, which are composed of racial minorities, low socioeconomic statuses, and people with less education in high school. Here is a brief presentation about ecological perspective of public health applied in our study. Individual level factor includes the lack of knowledge and awareness about type 2 diabetes. Interpersonal level factor includes the fact that only limited number of people receive quality diabetic cares, which will generate limited influences on our patient population. On a community level, examples such as program fees are not covered by insurance companies, or patients are not insured or underinsured are highlighted as important factors for the design of our intervention program. Next will be our primary focus of the study, that is the application of the health belief model. Starting from the perceived susceptibility, we are asking whether patients consider that they are at risk for experiencing complications related to type 2 diabetes. Moving on to perceived severity, here we are asking whether patients realize that type 2 diabetes is a chronic disease with multiple clinical implications. For perceived benefits, we are asking whether patients understand that the importance of adopting a behavioral change by enrolling to the intervention program can improve their quality of lives. And number 4, perceived barriers. Here we are asking for whether there's any barriers for the accessibility to care and services from our intervention program. And also, it will be important to know the insurance statuses from our patient population. Finally, the perceived self-efficacy. For this one, we are asking whether patients believe they can adopt such a behavioral change by participating in our intervention program to improve their quality of lives. So here's the overview of the public health intervention. It is an all-inclusive intervention program that combines both medical and non-medical care and services for diabetic patients with full insurance coverage from the government. The program is aiming to provide free primary care visits in the chronological consultation and nutritional supports from dietitians, since we believe that diet plays a key part in many of the type 2 diabetic patient population. So next will be the application of the logic model. Here we are using the model to answer the question of how to implement the intervention. Starting from the input, we are hoping that the partnership with local dietitians and primary care physicians can provide free diabetic consultation and a government-funded behavioral change program. For the output, we have two components. First, we are focusing on the regular clinical checkups for the patients enrolled in our intervention program. Second, we are hoping that providing participants customized nutritional assessment plans can improve their health status. For the outcomes, the shortened outcomes is aiming to have an increasing number of enrollments to the program. And for the medium term, we are hoping that a behavioral change on the community level will be seen. And our long-term goal is aiming to have legislation and policy making process taking place to provide free diabetic care for every American patient. So the next part will be the evaluation of the effectiveness of the intervention. So starting from the process evaluation, we are making sure each part of the behavior modification program implementation process is successful, such as examining the overall financial planning, coordination among dietitians, physicians, and public health workers and social workers. Next will be our impact evaluation. For this part, we are evaluating participants and stakeholders' awareness and knowledge towards type 2 diabetic care, treatment, and management. Last but not least, the outcome evaluation. Here we are asking whether the intervention program can provide promising quality of life indicators for type 2 diabetic patients, and especially the underserved population is our primary focus. So here marks the end of my presentation, and I thank you very much for your attention.